Welcome to Nursing Research Podcast for the University of Oklahoma School of Nursing. My name is Karla Meyer. I'm in the LVN to BSN program. I also have a bachelor's degree in biology, and I'm a yoga instructor. I have 20 years of nursing experience in long-term care, acute care, and most recently, pediatric home health. My reason for being interested in this topic is I would like to see more complementary alternative medicine intersecting with allopathic care, specifically yoga, controlled breathing, otherwise known as pranayama, for personal care and teaching to patients. Brief explanation: pranayama is basically controlled breathing, and it is exactly what it sounds like it is. Controlling your breathing. So there are various methods: long inhales, long exhales. You can also hold at the end of the exhale, hold at the end of the inhale, or combinations of any of those. My initiation into EBP is in this class. As LVNs, or at least 20 years ago when I went to school, we didn't learn about EBP. We didn't learn how to research. And I have to say that I'm excited for my future training and use in nursing. My clinical question: in patients with hypertension, does non-device guided breathing, which would be pranayama, reduce blood pressure more than device guided breathing? So the device guided breathing is referring to the respirate, which is a sensor around the chest. It's connected to a handheld device. There's a melody or a tune that is played on the device through earphones or earplugs, and that helps guide the patient to control their breathing. According to the American Heart Association, non-pharmacological interventions are recommended for all adults with elevated blood pressure or hypertension. Two possible barriers would be that a lot of allopathic providers are interested in alternative medicine or yoga. They might see it as a fake or sham. Likewise, patients could feel the same way. And sometimes it's just easier and faster to take a medication because the controlled breathing does take a bit of training and motivation. Two support mechanisms: you would need committed leaders and people following and supporting them to challenge traditions of, well, this is the way we've always done it. You would also need mentors and people to be trained in controlled breathing so that they could teach the patients. They would also need to be flexible and challenge their past beliefs. The research article I chose was a systematic review of 17 studies that showed that pranayama lowered systolic and diastolic blood pressure, and they recommended non-device guided breathing or pranayama as a reasonable initial treatment for low risk and pre-hypertensive patients. Implementing this evidence into practice, you would assign a project leader and a support team, determine the critical steps and tasks necessary, determine what support and resources are available. In this case, as far as resources, all you would need is people trained in the controlled breathing so that they could teach the patients. You would then implement the plan and, of course, evaluate the plan. And after the evaluation, you would see if there are any changes that need to be made or tweaks that need to be made, and then reporting the outcome to the stakeholders.